Making Sense of Your Medicare Options 2018. Hello, my name is Matthew Greiner, and in today's presentation, I'm going to give you an overview of what Medicare is and some of the things to expect when you turn age 65. The things that we're going to cover in today's presentation: program history, eligibility for Medicare, Medicare and You 2018. I also like to refer to this as the Medicare Bible. When to sign up for Medicare, looking at Medicare in terms of two perspectives: original Medicare and Medicare Advantage, Medicare cost, Medigap Plans, Medicare Advantage plans, Medicare cost review, the cost of original Medicare with a Medigap plan, and Medicare Advantage, extra help and special dates. Program history. Medicare was founded by the federal government back in 1966. It is truly a single-payer insurance program. You've been paying into Medicare since the day you got your first job. A portion of the payroll taxes went to fund the Medicare fund. Eligibility for Medicare. People that are age 65 and older and who have worked and had payroll taxes withheld. Also, people that have certain disabilities deemed by the Social Security Administration. Some of those are end-stage renal disease and Lou Gehrig's disease. Medicare and You 2018. I like to refer to this as the Medicare Bible. This is the official handbook for Medicare. It is published by the United States federal government, the Centers for Medicare and Medicaid Services. I recommend that you get a copy of this book. You should receive it around your 65th birthday in the mail. If you don't, you can call up Medicare, 1-800-Medicare, and request it. You can also get this book online going to Medicare.gov. Medicare, when to sign up. This is the number one question that I get from people turning age 65. When do I sign up for Medicare, Matt? The answer is you have a 7-month window around your 65th birthday to sign up for Medicare. So let's say your birthday is in December. You will have the whole month of December to sign up. 3 months before you turn, 3 months before your birthday, so September, October, November, and then 3 months after your 65th birthday, January, February, March. This is your 7-month window of when to sign up for Medicare. You can also see this description of when to sign up on page 21 in the Medicare and You 2018. Let's go take a look at page 21. Initial enrollment period. You can first sign up for Part A and or Part B during the 7-month period that begins 3 months before the month you turn 65, includes the month you turn 65, and ends 3 months after the month you turn 65. There's your 7-month window, folks. To sign up for Medicare, call up the Social Security Administration, 1-800-772-1213, and notify them that you want to sign up for Medicare. You can also call 1-800-Medicare to sign up for Part A and B. Medicare, graphically. You can receive your Medicare benefits through two channels. The first one known as Original Medicare, which includes Part A and Part B. Part A covers your hospitalization. So if you go to the hospital, Part A will be covering that hospital visit. It won't cover everything. There will be a deductible in addition to copays, but it will cover a good portion of it. Part B, I like to refer to this as your health maintenance or your doctor insurance. If you have to go see a doctor, this will be covered by Part B. If your doctor wants you to go see a specialist, this will also be covered by Part B. If they want you to get some lab work done, this will all be covered under Part B. Now, typically, there will be gaps in Part A and Part B in that coverage. So what people will do is they'll pick up a med sup to help fill those gaps so they don't have to pay as much out of pocket. This is one way of receiving your Medicare benefits, Original Medicare. The other way to receive your Medicare benefits is through Medicare Advantage, also known as Part C. The way I like to think of Part C, think of it as a network of healthcare providers. Very similar probably to what you had when you were working and you had an employer sponsored health insurance program. Might have been through a certain company ABC. You would have to see doctors that are in the ABC network. You'd have to go to labs that were in the ABC network. You'd also want to go to the hospital that's in the ABC network. This is very much how Medicare Advantage works. Think of it as a network of healthcare providers. If you go with a certain company, you're going to want to stay within their network of healthcare providers. Now, depending upon depending upon what type of Medicare Advantage plan you buy, whether it's an HMO or a PPO, you might have a very expansive network with a PPO or a more restricted network with an HMO. But I also want to point out many of the HMO plans have zero premium for those programs. Medicare graphically continued. One thing that we have not covered, and this is your Part D, or your prescription drug plan. Depending upon how you decide to receive your Medicare benefits will determine how you're going to have Part D. If you go with original Medicare, Part A and Part B, and you go with a Medigap policy to fill those gaps, you will also pick up an additional supplement for your Part D, for your prescription drug plan. If you go with Medicare Advantage, most likely, your prescription drug plan will be built into that Medicare Advantage policy. Medigap plans, standardized by the federal government, they offer the same basic benefits. They're identified by different letters: A through D, F through G, and K through N. Carriers can also add additional benefits. I want to point out that they are standardized by the federal government. This is a very important portion to understand about Medigap plans. They all have to offer the same initial benefits. If you go to page 79, if you go to page 79, Medigap policies are standardized. Every Medigap policy must follow federal and state laws designed to protect you, and they must be clearly identified as Medicare supplement insurance. Insurance companies can sell you only standardized policies identified in most states by letters A through D, F through G, and K through N. All policies offer the same basic benefits, but some offer additional benefits. You can choose which one meets your needs. I want to point this out. They all have to offer the exact same benefits. Here is a chart of the different Medigap plans that are available. Now, there are so many that are available, and I think they have too many holes in their coverage. The only two that really make sense to me is plans F and plans G. And the reason that I say that, if you look at plans F and plan G, they cover almost everything. Plan F, there is no gaps in coverage. Everything is covered under this policy. Plan G, almost the same, with the exception of the Part B deductible. The Part B deductible, you will have to pay that out of pocket if you go with a Plan G. Now, what is the Part B deductible? Remember, Part B is your health maintenance or your doctor's visits. So the first in in the year 2018, the Part B deductible is $183. You can see this on page 34 of the Medicare and You 2018 handbook. That means the first few doctor's visits, you're going to have to pay that out of pocket until you've paid $183. Once you've paid that, the policy will not cover the rest of the expenses. Medicare Advantage plans, specific to the local area where the plan is offered. Each plan is unique and different. Medicare Part A and B cost. Part A, when you turn 65, should cost you nothing if you've been paying into the payroll taxes. Now, if you did not pay into it, Medicare Part A will cost you up to $413. This is for people that did not work in the U.S. work system. Part B, on average, is going to cost the average American $134. It's based on your income. So if you're filing an individual tax return or if you're filing a joint tax return, it's going to be based upon how much money you've made. It could potentially cost you quite a bit. If you make if you make more than $428,000, Medicare Part B could cost you $428.60. Medicare cost, the Medigap Plan style. Medicare cost, Medigap Plan. If you go with original Medicare, Part A should cost you nothing. It should be free. Part B, on average, will cost most Americans $134 a month. To pick up a Medigap plan, typically a Plan F at age 65, on average, this is not specific to a carrier, but just on average, will cost most Americans $130 a month. If you pick up a prescription drug plan, on average, you're looking around $25 a month. So your total cost monthly for a Medigap, original Medicare with a Medigap plan is $289. Medicare cost for Medicare Advantage. Medicare Part A for most Americans should be free. Medicare Part B for most Americans should be $134 a month. Now, if you go with a regional HMO, you're probably looking around a $0 premium per month. Let me say that one more time. For an HMO, a regional plan, you're probably looking at a 0 monthly premium. So you're looking at, for your Medicare cost for a Medicare Advantage in terms of monthly premium, about $134. I do want to point out here that because you do not pay a monthly premium, when you go see a doctor, when you go see a specialist, if you have to get lab work done, there will typically be copays. Each plan will vary, so we're not going to cover those specific costs to the Medicare Advantage plans. Extra help. If you have limited income and limited resources and you need extra help you might qualify. A single person in the year 2017, if you made less than $18,090 and your resources were less than $13,820 per year, you would qualify for extra help. A married person living with a spouse and no other dependents with income less than $24,360 and resources less than $27,600 would qualify for extra help. If you think you qualify for extra help or want to know more about this, you can reach out to Social Security. Their number is 1-800-772-1213. You can also contact Medicare, 1-800-Medicare, or 1-800-633-4227. You can also contact a Medicaid office in your state. Myself being a resident of Nevada, I put up those numbers. The toll free for Medicaid in the state of Nevada, 1-800-992-0900. The local number, 702-631-7098. Special dates that you're going to want to remember. Your initial enrollment period, this is when you turn 65. It's the 7-month window around your 65th birthday. Your annual enrollment period. This starts October 15th and goes to December 7th. This is when you can switch your Medicare Advantage plans, special enrollment periods. This is when you move out of an area of plan coverage. So if you moving out of the area where your plan is no longer providing coverage, you will get an SEP or a special enrollment period to enroll into a new Medicare Advantage plan.